Cystic fibrosis is a genetic disorder also known as mucoviscidosis. It causes abnormalities in chloride and sodium transport channels, leading to mucus buildup in the lungs, pancreas, liver, and intestines. This in turn leads to scarring and cyst formation within the pancreas, which gives the disease its name. Difficulty breathing, sinus infections, diarrhea, infertility, and stunted growth are also common. Cystic fibrosis can be detected by genetic testing or sweat tests in early childhood. If not detected, cystic fibrosis can cause death in early infancy. People who receive proper medication, however, often survive for upwards of 30 years. The protein malfunction implicated in cystic fibrosis is the cystic fibrosis transmembrane conductance regulator, or CFTR. CFTR is a channel protein that transports chloride ions across the cellular membrane of epithelial cells, such as those lining the lungs and pancreas, among other organs. As it controls the flow of ions, it can also control osmotic potential and can affect water flow across the membrane. The gene that codes for the CFTR protein is located at locus 7q31.2, which means that it is located on chromosome 7, the Q, that is the long arm, and band 31.2. There are over 2,000 known mutations that can cause cystic fibrosis, the majority of which have only been recorded in one patient. The three most common mutations that can cause cystic fibrosis are F508del, which is present in 66% of cystic fibrosis sufferers, GF542X, present in 2.6% of sufferers, and G551D, present in 1.4% of sufferers. Del F508 is classified as a severe mutation. It is the deletion of the 508th phenylalanine residue in the CFTR protein. GF542X is a nonsense mutation that is classified as moderate. It involves the transformation of the glycine at position 542 on the protein to a stop codon. G551D is a missense mutation that is classified as severe. It is the transformation of the 551th glycine residue in the CFTR protein to an asparagine residue. As for the causes of CFTR dysfunction with each mutation, CFTR del F508 cannot fold properly and so is rejected by the cell for export to the membrane from the endoplasmic reticulum. CFTR G542X is an incomplete protein and thus is not effective at transporting chloride ions. CFTR G551D cannot transport chloride ions because it has a defective ATP binding site. Cystic fibrosis is the most common genetic disorder in Caucasians. Geographically, it is most prevalent in North America, Europe, and Australia. Because cystic fibrosis is a genetic disorder, no cure has been found. Respiratory therapy, however, offers the possibility of prolonging lifespan. Light backslapping can clear mucus from the respiratory tract, making it easier to breathe. Mucus thinners, antibiotics, anti-inflammatories, and bronchodilators are also effective in thinning mucus, killing bacteria, and reducing organ damage. Ultimately, however, cystic fibrosis worsens as time progresses. Lung transplants may be required and lifespan is drastically reduced. Scientists are hopeful that cystic fibrosis can one day be completely cured. Lab trials have shown that using organic solutes can alleviate the effects of the delta F508 CFTR alteration, promoting normal CFTR channel functioning. In another attempt to cure cystic fibrosis, scientists have found that injecting the compound PTC124 in lab mice has suppressed the effects of the G524X nonsense allele and restored CFTR to a normal condition.